Hi everyone. Today in this video we are going to discuss about Baclofen, how this drug acts, what are the side effects, clinical uses and precautions of Baclofen. What is Baclofen? Baclofen is one of the drug which is used to treat the muscle spasticity. Many of the times muscle spasticity can be observed with few of the autoimmune disorders like the multiple sclerosis. In such conditions Baclofen can be given. And this drug can also be given in the spinal cord injuries which also produce some spastic conditions. But most of the times Baclofen is indicated for multiple sclerosis induced muscle spasticity. In multiple sclerosis we can observe some flexor spasms which results in the difficulty in the movement, muscle rigidity and clonus movements. Some involuntary movements are observed in the patients. So all these can be controlled by Baclofen. Now let us see the structure of Baclofen. Baclofen is having the structure like this, and we can compare this structure with one of the neurotransmitter. This is simply carboxylic acid with a terminal group amine. So this is alpha carbon, beta carbon and gamma carbon. So gamma portion and amino group is there. So this is nothing but gamma amino butyric acid, otherwise simply it is called as GABA. So GABA is one of the inhibitory neurotransmitter within the CNS. Now Baclofen is a structural analog of the GABA which is having the similar structure with a para-chlorophenyl ring at the third position. So here the functional group is the carboxylic acid. So we can start the numbering from carboxylic acid. So this is 1, 2, 3, 4. So it is a 4 amino butanoic acid with the third position is having the side chain. So this is nothing but the para-chlorophenyl. So 3-4-chlorophenyl. So Baclofen is a para-chlorophenyl derivative of the GABA. Now let us see how this drug acts. The excitatory neurons within the CNS are storing one of the important neurotransmitter, that is the glutamate. This glutamate can act on the postsynaptic receptors which may be either inotropic or metabotropic receptors. In order to show the fast excitation, glutamate can act on the inotropic receptors. Now when this glutamate binds to these inotropic receptors like the AMPA, NMDA or kinase receptors, it produces excitation. Among these, NMDA is one of the important receptor which is controlling the functions of the glutamate. Now when the glutamate binds to these NMDA receptors, it is coupled with the few of the ion channels. These ion channels allow few of the ions like the sodium, as well as they also allow another type of ions, they are the calcium. In this way, by activation of the NMDA receptors by the glutamate, the sodium and calcium can enter into the postsynaptic membrane such that the postsynaptic membrane undergoing the excitation resulting in the motor activation. Now the spasticity or muscle spasms are because of excessive stimulation of muscles by excitatory neurons like the glutamate, which may result in the involuntary movements as well as muscle rigidity and flexor spasms. In such conditions, we can use the drugs which are going to control the motor activity and motor excitation. So here we can use one of the drug, Baclofen. This Baclofen acts on the GABA-B receptors. These GABA-B receptors are the inhibitory receptors. So when this Baclofen binds to the GABA-B receptors, it can modulate the functions of two types of ion channels. One of the ion channels is the calcium and another one is the potassium. Now Baclofen, by binding to the GABA-B receptors, it can inhibit the calcium channel activity. Therefore, the calcium cannot enter into the postsynaptic membrane. At the same time, potassium channel is activated such that potassium ions can go outside of the membrane. So these two activities results in the inhibition of the postsynaptic membrane along with the prevention of the excitation. In this way, Baclofen can produce the inhibitory response in the postsynaptic motor neurons, thereby can relieve the spasticity in multiple sclerosis. What are the precautions? Whenever Baclofen is going to be taken, because this drug is going to acting on the CNS, it can produce two important side effects like the drowsiness and sedation. So whenever this drug is combined with the other CNS depressants like alcohol, barbiturates or benzodiazepines, any of these CNS depressants can increase the drowsiness and sedation. So this drug should be carefully given along with the other CNS depressants. And again, the patient should be precautioned such that whenever Baclofen is going to be taken, they should not work with the machinery otherwise with the automobiles, which may impair their functionality. Second important precaution is the abrupt withdrawal of baclofen. Whenever this baclofen is suddenly withdrawn, it can produce a variable number of side effects and like withdrawal syndromes. So it can produce some hallucinations, and it can also produce some rebound spasticity, and it can also increase the muscle rigidity. Apart from these side effects, it can also produce other withdrawal effects like seizures, altered mental status, and high-grade fever. And sometimes it can also produce some rhabdomyolysis. All these are very severe and should be immediately monitored. Otherwise, it may lead to the death of the patient. So that's why the baclofen should not be stopped suddenly. So the dose of the baclofen should be slowly tapered such that we can prevent the withdrawal syndromes. And another important precaution is of withdrawal in the neonates. Normally this drug is not given to the infants, but when baclofen is used by pregnant women, so when this baclofen is administered during the pregnancy, this drug can be passed into the fetus. So it can produce the post-delivery complications. So after the delivery, the baclofen is not available to the neonates, which lead to some withdrawal syndromes. So it can produce few of the complications like increase in the muscle tone as well as tremor and seizures in the neonates, which are again fatal and should be carefully monitored. That's why when this baclofen is given to the pregnant woman, the dose should be slowly reduced, and the use of this baclofen should be discontinued before the delivery in order to prevent the post-delivery complications in the neonates. Next one is the risk of other disorders. Baclofen can also induce other disorders, like it can increase the psychosis resulting in the hallucinations. We have seen that even withdrawal can produce the hallucinations. Otherwise, by prolonged use of baclofen can also induce the hallucinations, and it can also increase the risk of seizures as well as postural imbalances, which may lead to some vestibular disorders. All this can be observed with the baclofen. What are the side effects? So already we have seen that baclofen produces few of the central side effects. So this drug can produce few of the side effects like drowsiness, dizziness, weakness, and it can also produce other side effects like nausea, confusion, headache, insomnia, lack of sleep, and constipation, and a reduce in the blood pressure resulting in the hypotension, increased urinary frequency. All this can be observed with the baclofen. And among these, drowsiness, dizziness, and sedation are the important side effects that should be carefully monitored when this baclofen is used for prolonged period. How it is given? Baclofen is given as a tablet form. The initial dose of the drug is at 5 mg 3 times daily, and based on the patient conditions, the dose can be slowly increased at a 5 mg increments up to the 20 mg thrice daily. So that's about the baclofen. Baclofen is one of a skeletal muscle relaxant which is centrally acting. It can be used to treat the muscle spasticity associated with the multiple sclerosis. And it can also be used to control the muscle disorders which are associated with the spinal cord injuries. This drug can produce some dizziness, sedation, and drowsiness. So this should be carefully given in the patients. And this drug can also produce some withdrawal syndromes. When the drug is suddenly stopped, it can produce some hallucinations, seizures, high-grade fever, muscle rigidity, and rebound spasticity. And within the neonates, again, it can produce the neonatal withdrawal syndrome resulting in the increased tremor, seizures. So that's why this drug should be avoided before the delivery. And this drug can also precipitate the other disorders like the psychosis, seizures, and some vestibular disorders. And this drug is given at an initial dose of 5 mg thrice daily. The dose can be slowly increased up to the 20 mg based on the patient conditions. So that's about the baclofen. Hope you have enjoyed this video. If you like this video, please subscribe to our channel. Share this video with your friends. Post your comments in the comment box. Thank you for watching this video.